We have a fire. I mean, it's a bad fire. The house is burning down.
Sam Kukic delivers a blunt message to the state's newly created Nursing Home Advisory Board, which is working to improve quality in the long-term care system. She founded her advocacy organization, Dignity for the Aged, after she says her mother-in-law received inadequate care at 5 different facilities leading up to the end of her life.
She was neglected a lot. I spent her last night with her in the nursing home, and she passed away at 1 a.m, and I pushed the call light. I couldn't find anyone to tell.
On Thursday, Kukic presented research to her fellow board members showing that 141 of Virginia's nursing homes, nearly half of them, are on the abuse watch list. The underlying issues to low staffing levels and poor quality ratings, she believes, are 1, minimal tracking of how facility owners spend money, much of which are Medicare and Medicaid dollars.
There appears to be little to no scrutiny by the federal government on how this money is spent. Private equity corporations are buying up nursing homes for profit, and no one understands the web of hidden ownership.
And 2, lacking enforcement of residents' rights.
Right now, they are in warehouses waiting to die.
But Administrator Todd Barnes, who runs a government-operated facility with high-quality ratings, warned the body against casting all providers in a negative light.
I think there needs to be that increased oversight and guidance to those nursing homes that need help to be efficient. But I think it's important that you bring in all the players and you recognize that there are a lot of buildings that are giving exceptional care.
That sentiment echoed by Jonathan Cook, the CEO of a chain of not-for-profit faith-based facilities.
The vast majority of the individuals who go to work, whether it's a CNA or a housekeeper, a nurse or administrator, they are caring, compassionate people who want to serve human beings. Now, are there some players out there that are motivated by profit? Yes, there are some of that.
One of those compassionate caregivers is board member Candace Gillum, a licensed practical nurse for August Healthcare.
I love being a nurse. I love taking care of my residents.
But she says she simply doesn't have enough help, especially post-COVID. On any given day, she's assigned to care for 15 residents at a time, and nurse aides, she says, are typically on a ratio of 1 to 10.
Some people may not understand. If I have 2 feeders in my set, and it did take me 45 minutes to feed this one person, that other one, they don't understand. You know, their loved one comes in and they don't know. They want to know why wasn't that person fed? Why did it take 45 minutes for somebody to get back there? I don't have anybody else. It's just me.
She believes many abuse and neglect cases in facilities are not intentional, but rather a symptom of a strained workforce.
But what are we doing in nursing homes to push our staffing? Because we need it.
Regardless of the root problem, advocates say families like Janet Payne are suffering. She attended the meeting to give public comment.
I went through it for 5 years. I lived a nightmare with my mother. She took 30 falls in a nursing home, 3 falls in the last 2 days of her life. That killed her.
And board members have been asked to sign up for one of 3 different subgroups to start discussing solutions and policy recommendations. Those focus areas include ownership transparency, financial reporting, vetting and licensing, and family engagement. I'm Tyler Lane for CBS 6 News.